For more Wellness Wednesday, here's Tessa.
Well, for many reasons, women might not be ready or even able to have a baby now, but she might want to do so later. Southeastern Fertility Center offers fertility preservation options for families. And Dr. Stephanie Singleton joins me to explain those options. Good morning.
Good morning.
Now, first, fertility preservation, what is that exactly?
That's the ability to preserve a woman's eggs so that she can use them later on at a later point in life.
All right, well, let's talk about this. This is Breast Cancer Awareness Month. How does that relate to cancer treatments?
Right, it's very, very important because this allows those patients to preserve their eggs before they undergo radiation, chemotherapy, those technologies and those medications that can actually harm their eggs and make it harder for them to get pregnant in the future.
Okay, and just about fertility preservation in women in general. Can you expound on that?
It's a wonderful technology that we have become better and better at. It allows women to preserve their fertility for when they are ready to use it later on. So even for women who are just putting off having babies at the current time, going to graduate school, very, very involved in their professional careers, they're able to preserve those eggs so that when they are older, they can use them when they're ready.
So in preserving those eggs, that's actually called cryopreservation?
Cryopreservation.
Or egg freezing.
Exactly.
Let's talk about that.
It's the technology of allowing that egg, which is predominantly water, to be frozen, but to maintain the mechanisms of the egg. For a long, long time, we had a difficult time freezing those eggs because of the amount of water. We've been freezing sperm for a very long time, effectively freezing embryos for a long time, but we had to perfect the technology of taking the egg from a liquid state to a solid state very, very quickly so that ice crystals did not damage the mechanisms of the egg.
Now, how invasive is that? Is that considered like a type of surgery? How invasive is that?
It's minimally invasive. It allows the patient to take medications so that they produce more than one egg in a given cycle. Okay. And then they come to the office one day for a 30-minute procedure where they're sedated, they're breathing on their own. Okay. It's minimally invasive. We can go in with a needle, retrieve those eggs.
Okay. Now, you do that through embryologists. What is an embryologist?
Right. Embryologists are highly trained professionals who help us with the eggs. So as physicians, we treat the patient with medication. We retrieve the eggs that are then handed off to the embryologist. They're actually the ones that find the eggs through the microscope in the liquid. They're actually the ones doing the cryopreservation, freezing the eggs.
And your center is the only place that does it in the Lowcountry.
Right. We're lucky enough at Southeastern Fertility Center to have the only highly trained embryologist in the Lowcountry doing cryopreservation.
And why are highly trained embryologists important?
Right, because they're the ones that actually do this technology. We as physicians are the ones that give the patients the medications that prepare them to produce the eggs, but it's the embryologists that are actually using the technology to freeze the eggs. So their presence, Rodney Wade, Peter Wykowski at our center, they're the ones who are actually cryopreserving the eggs and have the technology to make this work for patients.
Wow, and here's one final question for you. Who would be the perfect candidate for egg freezing?
Right. The perfect candidate is certainly someone who has been newly diagnosed with cancer. Hopefully their oncologist is going to refer them to come over to be evaluated to see if this is a possibility. Oftentimes it's a very short timeline because they of course want to start treatments. So we need to try to get those patients in as quickly as possible, and we work with the patients. We'll stay after hours, we'll fit them into our schedules. We understand this is a trying time for them. They're having to make some very important decisions very quickly.
Now, are you able to answer this question if once they've gone through their radiation or chemo treatments, the time between the two before they can actually try to have those eggs implanted?
Right. And we actually coordinate that together with their oncologist, with their cancer doctors, to make sure that they are at a stable point medically before we treat them. And then those eggs can be thawed, they can be fertilized with their partner's sperm, and then we can place those embryos back in their uterus to create normal and healthy pregnancies.
Great, great. Thank you so much for joining us this morning. All righty, well, keep it right here. We have more Lowcountry Live on the way.
1 minute to